Hi, I'm Megan Barrio, one of the 4 nurse injectors here at Cynthia Gregg, MD, Face and Body Specialists. Today, we wanted to thank you for coming for Patient Appreciation Day, and I wanted to talk to you a little bit about the muscles of the face and where we could put neuromodulators in those muscles and about what average dose we give for those. So we'll start at the top of the head and we'll work our way down. The frontalis is our forehead muscle, and we use those injections to help with smoothing out those fine lines and wrinkles that you get when you give a surprised look. And it's our only elevator muscle of the face. And so we try not to do too much to where you get a heavy feeling, and we can use that muscle still to our advantage. The usual dosage that we have for that area is anywhere between 10 to 15 units. It can go upwards of that or less, but again, that's the average. Moving our way down to the Globeller Complex, that's our procerus muscle and our corrugator muscles. That's on each side of our eyes here. And that complex helps with our depressor muscles, which pull down. And when we inject those with neuromodulators, it helps to elevate, give an opened eye appearance, which we really like for patients. FDA recommended dosage for that area is about 20 units. We can go upwards of that if needed. It does really depend on the strength of the muscle, but typically about 20 units. Moving outside to around our eyes, we have 2 circular muscles, the orbicularis oculi muscles. And when we smile, it can bring those down and it can create these lateral canthal lines. You might be familiar with those as crow's feet. And those we can inject there to help to smooth out around the eyes, again, giving a more open eye appearance and to get rid of those wrinkles that come up when we scrunch our face or smile. Typical dosage in that area is anywhere between 6 to 12 units on each side. Then we're going to move our way out to the masseter muscle. That's back here. It's responsible for our chewing and our grinding. You might know of TMJ or heard of that in the past. You can inject that muscle there with some neuromodulators to help to soften that muscle and to help with the atrophy. It helps to slenderize the face, and it can also give some relief from patients who have TMJ. Moving our way back in, we're going to talk about the nasalis muscle. When you get the globeller complex done, sometimes when you scrunch your nose up, you can get these little horizontal lines, and that's from the nasalis muscle. We call them bunny lines, and you can inject those anywhere from 2 to 4, sometimes 6 units in that area. And again, it just helps to soften that and not create those little crunches up here. And then we're going to come down and we're going to talk about our another circle muscle that we have around our mouth, our orbicularis oris muscle. And you can do a little bit of injections with neuromodulators on top, and you can do a little bit of injections with neuromodulators on the bottom to help kind of soften those perioral lines that you have. Some people call them smoker lines, even though you might not smoke. It just creates that vertical lip lines when you crunch up your mouth, and you can put some neuromodulators there to soften that area. It also helps create like a little lip flip too, which gives a little bit more show to your lips as well. And then if you have ever noticed in pictures or has someone maybe thought that you look sad, that can be our DAO, our Depressor anguli oris muscle that can kind of pull down the corners of our mouths. You can inject those 4 to 8 units on each side, and it can help neutralize your mouth so it doesn't look quite so downturned. As we age, that muscle gets a little bit more of a strong pull, gravity wins, and so it pulls everything down, and we can help relieve some of that pull. And then next we're going to talk about the Mentalis right on your chin. It can create like a peau d'orange or that orange peel look that you get from pulling up. Again, as we get older, that becomes a little bit more strong. And so you can do a couple of injections there, 4 to 8 units on each side here to help soften that and elongate the chin. And a bonus, it's not necessarily the face, but it's another area that we can do neuromodulators is the neck, the platysmal bands. When you kind of clench your teeth, you can see some of these bands here, and you can inject those. It helps to slenderize the neck and give a nice feminine appearance. So we can do that too. Bands, each band usually can be anywhere from 10 to 20 units, again, depending upon the strength. So thank you so much for listening to all the different areas that we can inject with neuromodulators. We really appreciate you, and we welcome any questions or send us an email. Our email address is injectablequestions@cynthiagregmd.com. And otherwise, we will look forward to seeing you soon. Thanks.